Now back to our other big story, the passing of Jeff-Conaway. He was a familiar face on both film and television, but even with all his success, actor Jeff-Conaway couldn't erase his addictions to drugs and to alcohol. Tonight, family and friends mourn his passing. Who doesn't remember Conaway from his 1970s role alongside John Travolta and Olivia Newton-John in the hit movie Grease? He often blamed his accident on that set for leading to his addiction to painkillers. He went on from there to play Bobby Wheeler in the popular sitcom Taxi, but his career was plagued with substance abuse problems. In 2008, he appeared on a popular reality show, Celebrity Rehab. Allowing the cameras to cover his drug and alcohol addiction, Conaway had been in a coma for 2 weeks. He was found unconscious at his home from an apparent drug overdose. And joining us now to talk about Conaway's battle with drugs and alcohol is addiction specialist Dr. Gregory A. Smith. You know, Dr. Smith, when someone has an addiction for decades, as it appears that Jeff did, how can you really help someone battle those demons?
Well, you know, being on narcotics for 1 year, 5 years, 20 years, it's all sort of the same process. But I think more than likely this gentleman needed to be on a maintenance drug such as Suboxone or something like that. So would keep him from craving these medications on a day-to-day basis.
So it sounds to me like you're replacing one drug with another drug.
A lot of people feel that way, but I look at it's almost like insulin for a diabetic. So if this is going to keep him from abusing prescription drugs, then I have no problem with someone being on long-term Suboxone therapy.
So how do you distinguish, or when you're treating the person and you're treating the addiction, how much of it is behavioral? How much of it is a physical addiction? How much of it is what's going on in your head?
Well, this is a great question. You know, there's definitely genetics involved here because there's some people that can take one Vicodin, like after a dental procedure, never take it again. There's someone else that takes it, and it's like a light switch goes off, and they just want to take it all the time. So there's a genetic component, which you can see like a mother or father also having addiction problem. There's a physical component because when someone takes a drug, they're basically trying to change their state. They want to feel better now. So that's the physical part. And then the psychological part is after you take these drugs for so long and you feel better and you're able to behave in a better way, you're able to perform better, then you're gonna want to psychologically take these drugs over and over again to get the same effect.
Do you think, you know, when we hear about these celebrities, this is the worst possible ending, you know, an overdose and then death from the drugs. But we hear of a lot of celebrities dealing with this, but really, are they any different than what, you know, you might callously call the street junkie?
You know, this is a huge, huge problem. I have personally dealt with, you know, celebrities, doctors, attorneys, people from all walks of life, and prescription drug abuse right now is dwarfing the illegal drugs. So when you look at someone that's taking heroin, cocaine, methamphetamine, prescription drugs is killing 3 times as many people every year than those drugs combined. So this is an enormous problem. So yes, you can look at these people, they look like you and I, but they are having just as much problem as a street addict.
And what is the difference between the drugs, the prescription drugs? What kind of effects are they getting from that versus what you would get with, you know, cocaine or meth or heroin?
Well, you know, here's the thing that's interesting. When someone has a prescription drug, the pharmaceutical companies make those drugs so they work well. They were made in a laboratory to really bind the receptors and things of that nature. So in many ways, at least for me, I think it's easier to get someone off of a drug like heroin than it is for OxyContin because the drug binds so tight in the nervous system.
Really?
Yeah.
Wow, that's shocking.
This is, yeah, this is, and the other interesting thing is that there's so much heroin coming into this country right now because of when we invaded Afghanistan and they stopped growing wheat, started growing poppies.
Yeah.
So we have an enormous amount of black tar heroin that's flooded the streets of America, and it's cheap. So
it's cheaper than Oxy, isn't it?
Right. So we're getting a rebound effect. We're seeing more and more people on heroin because they can't afford to get the OxyContin.
Oh, it's just so sad, you know? Just so sad. Thank you so much, Dr. Smith. We appreciate your time. Thanks for coming in today.
Thank you.